Well, let's switch gears to our conversation of the day. We're trying to understand cosmetic surgeries and procedures, and to help us do so, we have the experts in studio and, of course, recipients of these services too. So I'll start off introducing Dr. Tillman Stash, who is a plastic reconstructive and aesthetic surgeon at Vitality Fountain Clinic. Next to him is Dr. Christina Sule, who is a consultant obstetrician, general and cosmetic gynecologist from Alora Medical Practice. And of course, right next to me here is Pauline Buoga Adhiambo, who is a Gigantomastia patient. Yes, I finally got that right. And we are also joined on phone by Lucy, not her real name, and she's also a recipient of cosmetic surgery. Thank you all for joining us on this conversation, and I'm sure there is a lot of curiosity in as far as the same is concerned. And remember, our question of the day to you is, if you had the choice, would you alter any part of your body surgically? Remember that hashtag is a new normal, and you can also reach us using those numbers at the bottom of your screen. I'll start off with you, Dr. Stash. We are talking about you being a plastic, reconstructive and aesthetic surgeon. What is the difference?
Okay, thank you first of all for inviting me. Allow me to explain the word plastic surgery. So plastikos is a Greek word for molding and forming and shaping. So that's basically what a plastic surgeon does. Okay, so we deal with everything to do with the soft tissue of the body from head to toe. Now, where, for instance, the orthopedic surgeons deal with the bones, the craniofacial surgeons deal with the bones of the head, etc. The plastic surgeon basically does everything with the soft tissue. So in order to become a plastic surgeon, it's a very long training. In my case, it took 16 years from medical school to general surgery and then plastic surgery. And you undergo training in all fields. So the 4 pillars of plastic surgery, basically burn surgery, hand surgery, reconstructive surgery, and plastic aesthetic or cosmetic surgery. So as you can see, those are completely different categories. Okay, so the reconstructive surgery part of plastic surgery deals with trauma, cancer reconstructions, congenital malformations, where a plastic surgeon can restore form and function of the patient. Cosmetic surgery, on the other hand, mostly those are patients who are healthy and who have some kind of issue with parts of their body that can then be, again, molded and shaped into the shape that they desire.
All right, so at this point, let's differentiate cosmetic surgery and cosmetology, if there is a difference.
Right, I think cosmetic surgery deals with the surgical part of things.
Okay.
So using a knife, making an incision in the body, and even liposuction, whereas in liposuction the incision is very, very tiny, but still that comprises cosmetic surgery. Cosmetology is more like the practice and the procedures of beauty therapies. So for instance, we have a Medi-Spa attached to our clinic. So that involves basically all beauty treatments, starting from facials, deep cleansing facials, hydrofacial, chemical peels, laser treatments. But cosmetology also involves nails, beauty therapies, massages, etc.
Okay, interesting. So over to you, Dr. Sule. I mean, I said I was bringing in a cosmetic gynecologist, and everyone was like, what do you mean? So what is cosmetic gynecology?
So cosmetic gynecology is it's the aesthetic changes that women undergo in order to be able to enhance their female external genital structures. And the interesting thing about it is that they're not just enhancing them, but they're also eliminating pain during sexual intercourse. They're also increasing aesthetics, they're improving their self-esteem, and they're improving their sexual function. So it's not, cosmetic gynecology isn't necessarily about the way the external female genitalia look. Sometimes it's also about the function. In fact, largely due to sexual function is some of the reasons why women would undergo cosmetic gynecology.
Okay, so what causes the need for cosmetic gynecology?
So I think to be able to understand the reason why women would undergo cosmetic gynecology, we need to understand the role of childbirth and aging and what it does to the internal and external reproductive organs. So basically, when a woman undergoes childbirth, there are a lot of changes that occur to her reproductive system, not just to her uterus and to her ovaries, but also to her vaginal canal and the external genitalia. And this especially applies to women who have vaginal deliveries. And so during a vaginal delivery, of course, other than the other changes, there's a lot of stretching to the vaginal walls, and women can develop laxity. And other than that, the external genital structures can also have certain changes that make them have a less youthful appearance. Now, other than the anatomical changes that happen, we also have the physiological changes. So women after childbirth tend to have low libido, they tend to have vaginal dryness and other issues that involve their sexual function. For example, difficulty in achieving orgasms and other issues. And then aside from the childbirth, we have the issues of aging that can affect women that would want to have cosmetic gynecology. So basically with aging, we still do have vaginal dryness, we still do have laxity, we have changes on the external genitalia that make them look less youthful, but at the same time we have something called genitourinary syndrome of menopause, which is where women get changes in their vaginal canal that make it brittle, make them more exposed to tearing during sexual intercourse. They tend to get urinary incontinence. And so the role of childbirth and aging is really significant in women who want to achieve, you know, cosmetic gynecological surgery. And of course, there are those women who simply do it for the aesthetic reasons.
Okay, and we'll get into the more details of cosmetic gynecology in a moment. Let's introduce Pauline. As I said, she lives with a condition called Gigantomastia. Wow, that's quite a mouthful. Let's have some graphics on screen to actually explain exactly what this is. And it actually is a rare condition that causes excessive growth of the female breasts. It is, though the causes are not known, it is greatly associated with pregnancy, puberty, certain medications, certain autoimmune conditions. And some of the symptoms, of course, apart from the excessive growth of the female breasts, is breast pain, pain in the shoulders, back and neck caused by the excess weight of the breasts, redness, itchiness, and warmth on or underneath the breasts, poor posture, infections, loss of nipple sensation. So, Pauline, Gigantomastia, when did you get this diagnosis?
When did I get the diagnosis? I got the diagnosis in October 2019. But I always knew I had it. I just needed to have a doctor tell me you actually have it.
So you knew it was called that?
I didn't know it was called that. But I'd learned from the foundation that there's a problem of excessive growth and it's called Gigantomastia. But growing up, I didn't know that that's what it's called. I just thought like your breasts are just big. It's not really a condition. It's not really a problem. They're just big. Yeah.
All right. And you mentioned that this is something that runs in your family.
It does. My grandma had quite large breast. My mom has large breast. And then I had large breast.
Okay.
Yeah.
So at what point did you decide that you needed to do something about it?
I was totally against it. I was against it. My mom floated the idea like 2 years before I decided to have it. And I was just like, no, I'm not going to do it. And my friends always sent me links and they were like, watch this channel. They're talking about Gigantomastia. And I was like, I'm not changing anything about me. I am okay. What makes you guys think that I should change something? Then at one point in August 2019, I went for a concert. I sing. And everyone was looking at me crazy, like, oh, she's different, and my uniform wasn't fitting right. So I started feeling the need to really have the surgery done, have something done. But at first I was completely against it. Yeah.
Okay, so just reading up on it, they say, again, it's associated with puberty for some people, pregnancy. So for you, is it when you hit puberty that you noticed that there was something different?
No, when I was in class 4, they were bigger than everyone else's. And
Class
I remember
4, you're a child.
Yeah. I remember this one lady walking up to me and just being like, don't slouch, just walk straight. And because she had noticed that my breasts were showing and I was trying to hide them by walking like this. Yeah, so I think from class 4 they had started showing. Yes, and they grew bigger by day.
And we talked about some of the symptoms. What were some that you dealt with? The back pain?
The back pains. I think every time I got home from either school or work, I would just take off my bra and let me lie down for 2 seconds because I need it.
Well, every woman feels that way at the end of the day, but hey, I can imagine yours was
I used to
different.
wear 2 bras, and then it's very tight on the the strap, because I really want them to be,
perky.
to look perky, and they were extremely long and pendulous. So I used to have the back aches. I used to have infections, and sometimes there would be like a stench, and then I would go to a doctor, and of course they would give me medicine, but it would reoccur. Yeah, I think it's because of the sweating. I really am not sure. Yeah, and plus when you have that, I have this one bra that fits well, so that's what I'm going to wear. So I used to wear the same bra. Yeah, I think also led to the infections. Yeah.
Okay. All right, Dr. Stash, explain to us what Gigantomastia is, and if this is something that you commonly see.
Yeah, I think it's a perfect example for a condition where you would say this really helps the patient. I have a lot of patients, or a lot of women come to me with large breasts. The medical term is macromastia, and gigantomastia starts when you do the surgery and you remove more than 1 kilo of breast tissue on each breast.
Wow.
So you have to imagine that the patients really suffer from this. So the condition basically is very large breasts. You've explained it well, and one of the hallmarks of this condition is the patients come to me. They say, "I've tried everything. I've tried losing weight. I've tried buying the perfect bra, but it just doesn't work." A lot of my patients have neck pain, back pain, to a degree that they even get tingling in their fingers, etc. So then, a good thing about this condition, it's medically recognized by some of the insurances. So if you have a good insurance, they would cover this, because it does impact on the patient's health afterwards. So reducing the breast usually takes about, it's a 2 to 3 hour operation under a general anesthetic. And we remove the excess breast tissue without touching the nipple. I think that's very important. A lot of women are afraid of losing sensitivity in that area. So nowadays the techniques are advanced enough to not even go there, and allow also the women to maintain their breast ducts in order to be able to breastfeed afterwards. Because this kind of condition can be operated on even by even with patients who are in their 18 years old. As we heard, in puberty, sometimes it starts in puberty, and girls are still not completely formed, but their breasts are huge already. So for them, going through puberty makes it a big stigma, and then further life, I think the breasts just don't get smaller.
Okay, Dr. Sule, I'm sure this is not strange to you, because it falls under gynecology. A woman would come, perhaps theirs has been, it's associated to pregnancy. And do you explain to them that there is this option that you could actually surgically deal with, or there's some that just hang on to the reality they have to deal with?
Honestly, for women who are pregnant, we don't do any interventions during pregnancy, because it can happen a lot during pregnancy. The ducts can start filling with milk way before delivery even happens. And so for many of the patients who do come to me with this problem, I usually try to ensure that this is something that is sorted out either before they get pregnant or way after breastfeeding, because breastfeeding is another thing that can make the breasts become quite large. So pregnancy and lactation is definitely not the time to do it, but immediately that's over, it's actually not necessarily a gynecological issue. I'm usually happy to hand over to a breast surgeon, so that then they can exclude any pathology and just ensure that it's not cancer, it's not any kind of mastitis, and then once that's been excluded, then the plastic surgeon is free to go ahead and do the reduction once the patient is willing. Of course, not all patients are willing. In some cultures, it's actually a big deal to have very big breasts, and so most women are not necessarily necessarily going to go for it, and they might be discouraged culturally to have their breasts reduced. But of course, there are those who develop symptoms who then absolutely have to have the procedure.
Okay, and we said it's a rare condition, but how often do you see it?
I often don't see it very much, and if I do, I don't notice it very much because my patients are mainly pregnant or just after delivery. So if they did have big breasts, I wouldn't really notice it much.
Yeah. Interesting. And for you, Dr. Stash, in this continent, in Kenya to be specific, is it more common?
It is very common. Yeah. So I think the definition of gigantomastia, maybe that's rare, where you have to fit the category, but large breasts and macromastia is very, very common. And it affects a lot of women. And most women probably don't know that there's a solution for it.
Okay, let's bring in the other person who is actually a recipient of surgery, and that is Lucy. As I said, we are not using her real name. She asked us that she stays incognito. Well, Lucy, you underwent a tummy tuck. Why?
Good morning.
Good morning.
Yeah, good morning, and such an honor to be part of such a beautiful panel. Yeah, I underwent a tummy tuck around 4 years. And the reason why I underwent a tummy tuck was repeated pregnancy. And I used to carry very heavy pregnancies. So we got to a point where there was a lot of wear and tear, there was beyond repair, no amount of exercise or diet will correct it. So I stumbled across Dr. Stash, and I went for a consultation, and he has a lot of depth when it comes to tummy tuck, and he guided me through it, and my life has never been the same again.
Okay, so you said you carried heavy pregnancies and at some point it was not working out even if you tried to work out and to eat right?
Yes, it got to a point where it was actually repairable because some of the weight I was carrying around my tummy was basically a block of meat to death. Yeah.
Okay, interesting. And you've said it's been 3 years since you underwent this. And what are the differences you see before and after? Of course, we can see the pictures, but yeah, physically.
Yeah, before and after, obviously, I have to make this very clear. It is beyond skin deep, It goes far beyond just aesthetics. There's more, you enjoy more confidence, you look better, and your effort, your day-to-day effort into your well-being they actually show. And I started having back pain, lower back pain, before I underwent the procedure. And after that, I've never had lower back pain ever again.
Interesting. Okay, so Dr. Stash, a tummy tuck, is that what we call a gastric bypass?
Okay, thanks for asking that question. I think we need to clarify that.
Yeah.
So gastric bypass is a completely different operation.
Yeah.
Performed by a bariatric surgeon. So a gastric bypass basically is ideal for a very obese patient who has tried to lose weight, but due to various reasons cannot lose the weight. So they undergo laparoscopic, so keyhole surgery, where various methods can be used. So most of the time the stomach is reduced, and thereby they lose weight over a couple of months' time. So that's a gastric bypass. Now, Lucy didn't have a gastric bypass, she had a tummy tuck.
Okay.
So a tummy tuck basically forms part of a mummy makeover. So a mummy makeover, basically you're a beautiful woman, you have babies, you have one baby, you have two babies, you have three babies, and then you wake up in the morning and you feel, okay, my tummy does not look like it used to anymore. Now, apart from the aesthetic side of it, so you've seen the pictures, overhanging tummy, lots of stretch marks. A lot of my patients also have what is called a rectus diastasis. So that means the six-pack muscles are not together anymore. So when you're pregnant, the six-pack muscles basically stretch. And then at some stage, and again, it depends on genetic factors and how big your baby was, etc. At some stage, these six-pack muscles don't go back together anymore. And this causes a lot of discomfort. So you can get herniation of your abdominal contents. Basically, every time you stand up or every time you eat, you have this protruding tummy. And a tummy tuck addresses this as well. So apart from just taking away the fat and the tissue and the stretched skin, we also go in and stitch the six-pack muscle back together. So if you have this kind of loose muscle, afterwards it's nice and tight again. So that gives the core more stability. I guess it decreases back pain as well, and just you can see the patients just walking upright and much prouder and happier. So that's all part of a tummy tuck.
Okay, interesting. I love the way what you do crisscrosses and kind of meets with what Dr. Sule does, because rectal diastasis is such a big issue for women after birth. How common is this?
It's actually very common in women. The degrees are what varies. So when you have a very wide separation, that's not so common, that's pretty rare. But you can have a mild degree of separation or a moderate degree of separation. It's actually quite common. If you are a patient who's going to undergo a cesarean section, then you might be lucky because, okay, generally I during cesarean sections like to bring the rectus muscles together and stitch them together so that, because I know it's going to happen, I anticipate already the diastasis has happened during pregnancy and after delivery we don't want that bulging tummy. So, but that's because I'm a cosmetic gynecologist. Not everybody does that, but it's prudent to bring the rectus muscles together. Now, woe unto those who have a vaginal delivery, they do not get the chance to have their muscles brought together during surgery, and so they are the ones who are more likely to undergo a tummy tuck and probably have the rectus muscles reconstructed and brought together.
So are you saying when you're working with a patient and you can tell this is going to be a possibility, you actually tell them that they have an option for you to stitch them back together during CS?
I don't actually tell them. For me, it's just a standard.
Oh,
it's
it goes
something I always do.
It's a package
So
with
people,
the CS.
Yes. So people do cesarean sections in different methods.
Yeah.
There are those who prefer not to bring together the rectus. There are those who do prefer. For me, it's not necessarily anything that I inform the patient. It's just something that I usually do during my cesarean sections.
Interesting. I'm sure there's some women who are saying, where were you when I was having my CS, to help me out with this? And even as we talk about this, I think there is a lot of myths and misconceptions, you know, around what we're talking about today, whether it's cosmetic, plastic, reconstructive. For you, Pauline, it was such an important thing to do because it relieved you of a lot of stigma.
Yeah.
Talk about that.
At first, I like I said, I was against it.
And if you realize her eyes are actually tearing up because she's gone through quite a lot.
Yeah. I wasn't for the idea, but I was suffering and I needed to do something about it, but I was completely against it. And everyone talked me out of it. They were like, do not go through it, do not do it. What if you don't wake up from it? Yeah, so it has been a journey. Can I take 5? Yeah.
I hear you,
Yeah.
even as you catch your breath. I mean, Dr. Sule, we said it restores some patients' dignity. Thank you, Dr. Sash, for being a gentleman. It restores the patient's dignity, and I think people don't understand to what extent, and Pauline is one of them. Talk about the experiences of working with some of these patients.
Yes, in my field, cosmetic gynecology does restore dignity to some extent because after childbirth and during aging, a woman can tend to feel like, you know, her purpose is done. She was here to have babies and now she's no longer needed. She's no longer as beautiful as she was. She's no longer sexually appealing to her spouse. And these are things that could really, really bring down self-esteem. A woman who was previously extremely confident, extremely, you know, focused and happy with her life is now, you know, looking broken. And it's unfortunate that certain procedures like this are the ones that have to build our self-esteem, but they actually do. And the truth of the matter is I get very many patients who come to my office and they are literally grasping at straws to keep their marriages together, to keep their relationships together, and it shows that their self-esteem has definitely been affected. And we're just more than happy to offer both surgical and non-surgical solutions to these problems. So the self-esteem is definitely affected.
Okay, let's come back to you, Pauline. If you can give us perhaps an instance that you remember so vividly of some of the horrifying experiences you've undergone.
There was one time that I was walking with my dad. I think he was walking me to school, and I was in my uniform and all these things, and I was in primary school, and I had I don't know what to call them, conductor, and he just yelled out and he was like, "Madam, you're my size," and I was like, why would you say that to a kid? Like, okay, no, it looked big, but why would you say that? It just isn't right. And I used to get lots and lots of those comments. And every time I went shopping for clothes, I'm trying to get my own clothes. And people would be like, "Madam, come and buy clothes for your child." And I don't have a child. I am a child myself. I don't have one. So why would you say that to me? And all these things used to really hurt me. I think I used to go to my room and just lock myself out and just really cry and really ask God, like, why would you give it to me? Why wouldn't you just give it to someone else? Why would you give it to me? And I think I missed out on part of my growth as a teenager because everyone treated me as a mature person and everyone is treating you like someone who has kids and is just really grown, but I'm just treat me like a child. I am a baby. I am 19. I am 15. Treat me like a 15-year-old. I'm not that old. Yeah. So I think those were some of the things that just I felt bad.
And you said you are also a victim of trolling.
Yes. There was one time we had a music festival in school, and I remember walking with a friend of mine, and so there's a school bus for a boys' school, and everyone in the bus, a boy just yelled, "Oh, madam, unakaje?" And then everyone just started laughing, and then everyone is looking at me, and everyone is laughing, and I'm like, I didn't choose to look like this. Why would you make a joke out of it? Yeah, and there were times like when I had arguments in school, and people were like, "Noanda matiti yako ni kubwa," and stuff like that. So it wasn't really nice. It wasn't a good experience.
Oh, wow. That
Yeah.
must have been difficult. And I just want to hear also from Lucy, what have been your experiences? Because they say stigma can be from within or without.
Hello?
Hello.
Yes.
So what is your experience?
Like you mean before or after?
Yes, the stigma, because it can also be a personal stigma from within and it also can be from without.
Yes, I think for me mostly lied within my marital space. Before I was confident, I didn't have any issue like, dressing in front of my partner or showering, just normal day to day. And then after I finished giving birth, it started affecting me mentally a lot. I used to, everything I used to do was was just behind the locked door. Showering, dressing, everything. So it really affected my marital life. And that's where my partner and I sat down and we decided, what, we have to address this elephant in the room. And I'm grateful that he was very supportive. Yes.
Now, Dr. Stash, I'm sure listening to the patients, you hear this on a daily, how much some of these procedures have literally turned around lives.
Yeah, I think these two examples really illustrate the psychological impact that body conditions can give you. So I think it has to be said, I love patients, or I love people who are completely happy with their body.
Yeah.
Okay, so they're probably the majority of humans on this earth who are very happy with what they have, whether their nose is big or their ears are big or their thighs are too big or too small. All of that is totally fine. But you don't know what that individual thinks of their own body. So I think it's very important not to judge anybody who undergoes plastic surgery, because they might have their own story behind the wish to change something on their body. So I always try to see that. And I have wonderful patients, and I think all of them who come and see me, they have, I would say, valid reasons, where I say, okay, fine, I can see what you're talking about. Tell me more about how it makes you feel, and and this is what I can do for you. So if you have the expectations that are let's say that are valid, the expectations that can be met through surgery, then that would be somebody who's ideal for this kind of procedure. However, on the other hand, you have people who have expectations that cannot be met. Okay, so now we're getting into a field where you need to assess, okay, why is this person coming to me? Maybe something is bothering them, but it's not something that can be solved surgically. This is maybe something that a psychologist needs to sort out first. I think those are the aspects that a plastic surgeon has to deal with on a daily basis to decide, okay, are you a good candidate for this? Can I really help you? Can I make your life better? Or are there any other avenues where we can work with you?
So you can literally say no to a patient momentarily for them to sort out their psychological health before you even look at what you can do for them physically.
I think it's a big part of being a good plastic surgeon to be able to say no and still portray that message to the patient in a way that they don't feel offended. The impact of just having surgery and then that not changing your life is probably worse than maybe sorting out other things in your life first.
Interesting. Dr. Sule, there are those who are listening in on this conversation and thinking, you know what? We were taught to love ourselves as we are, just hang in there, deal with what you were dealt, and just live a normal life. I mean, how now do you separate these two notions?
Well, yes, it's true that, and it's a good thing that people are taught to love themselves and to, live with what they have. But it gets to a point that a patient is occasionally not able to do that. And so, and I completely agree with Dr. Tillman that it really is very important to have a psychological assessment, at least a brief one. We're not psychologists, but you need to be able to assess the psychological status of a patient. Sometimes I get patients who have postpartum depression, and that's the reason they're coming in for a cosmetic gynecological procedure. Sometimes I get patients who have body dysmorphic disorder, and you can just tell, and they may want a cosmetic gynecological procedure for that reason. So it's really important to have that assessment as a doctor, being a neutral party, to see, is this person of completely sound mind? Are they able to consent for this procedure? Is this really something that they need? Because it really is important for women to only have these procedures if they require them. Of course, there's a lot of procedures that are done recreationally, especially in cosmetic gynecology, and that's to enhance sexual function. However, there are certain procedures that we do actually say no to, and that is prudent. So a good psychological assessment is quite important.
Okay, and we've talked about the value of cosmetic surgery, but then again the question is, what are these procedures that you actually take up? What is this that is on offer?
So there's several cosmetic gynecological procedures, really anything that enhances the female external and internal genital structures and also enhances sexual function can be seen as a cosmetic gynecological procedure. We have a lot of non-surgical therapies. For example, we have vulvovaginal rejuvenation, which can be done in several ways. It can be done via radiofrequency therapy. It can be done via high-intensity focused ultrasound therapy. You can do a laser vulvovaginal rejuvenation. We do have procedures such as fillers. For example, for those whose external genitalia are starting to lose their more youthful appearance, we can fill them in after doing a mini liposuction. We can fill them in with the patient's own fat, or we can use a synthetic filler to make the external appearance a bit fuller. We do have therapies such as platelet-rich plasma therapy, which is actually a therapy that has been used in several fields of medicine, in dermatology, in cardiology, in sports medicine. It's a way of taking the patient's blood, separating platelet stem cells and other growth factors, and then re-injecting them into the body to allow the body to regenerate itself, form new tissues, new blood vessels, more more sensitive nerve endings. So that's some of the therapies that we use for sexual dysfunction. For example, if you've heard of the orgasm shot, that is about the platelet-rich plasma therapy. We also have surgical procedures for women, for example, who have something called hypertrophic labia minora, which is where the inner lips of the vulva are way longer than the outer lips. And then this now causes a problem with exercise, with walking, with sexual intercourse. They tend to crack and bleed a lot during sexual intercourse. They're unable to wear the outfits that they would like, for example, something tight-fitting. And so we can do a surgical reduction of that called a labiaplasty. We can do vaginoplasty, which is surgical tightening of the vagina. There's clitoroplasty for those women who have a clitoral hood that's way longer than what it's supposed to be. It can be reduced as well. So there's a really wide array, and this all depends on the symptoms that the patient is experiencing.
Oh, wow, interesting. So what are the common plastic surgery procedures in Kenya today, Dr. Stash?
Well, the commonest, I think, is body sculpting, so liposuction, and then either just leaving the liposuction as is or using the fat to transfer to other parts of your body. So this could be into the breasts in order to fill the volume of the breasts. Or a very common operation is the Kenyan butt lift. So this is adapted from the Brazilian butt lift. Now, we're not in Brazil, we're in Kenya. Kenyans have different bodies, different expectations of how they want to look like. So a Kenyan butt lift basically removes the fat from areas where you don't want it. So maybe getting a narrow waistline and then filling out the hips and buttocks in a safe way. So it has to be said, it has to be safe, so it has to be done by a qualified plastic surgeon who's got a lot of experience in this field, because obviously these kind of surgeries don't come without risks. Another common operation, I mentioned it before, is the mummy makeover. So these are tummy tucks with tightening the six-pack muscles and then recreating the breast mold that they had before. So either filling it with fat, silicones, or breast enlargement, or breast reduction, or a breast lift.
Okay, we talk about, especially with the butt lifts and the boob lifts and all that, and from what we see from the Western world, silicone is used a lot, and there's so many accidents around silicones. You hear one moved, one popped. So here in Kenya, how do you walk a patient to understand the risk factors in both choices, I guess?
Yeah, I think there's a lot of misconceptions also around silicone. Okay, so you're not gonna have an accident in an aeroplane. Okay, so silicone nowadays, these are like the sixth generation silicone implants. And again, there are different ones. There are the cheap ones, there are more expensive ones, and usually reputable firms produce better implants. So that's the first thing I think I need to tell the patients. So nowadays the implants have improved. They don't rupture anymore. They don't kind of burst, or I don't know what else is there out there. They're actually like gummy bears. Okay, so you cut them open, and it's kind of a bit rubbery like a gummy bear. So the silicone can't also leak out. Okay, it's not liquid silicone. It's actually more or less it's a cohesive gel that they call it. It is also surrounded by 4 layers of a shell that then prevents any even microscopic leakage of the silicone molecules. And so using silicone breast implants, I have to say, is safe. Millions of women have it all over the world. There are some instances where you have side effects or where there are complications. That is important to tell the patient as well. So a well-informed patient can then make a decision whether they want to have it or not. The silicone implant then obviously enhances the breast volume and also lifts the breast. But the alternative is to use their own fat. So that is quite popular in Kenya, I think, where women want to have 2-in-1, so to say. So they lose some fat from the tummy, and then we enhance the breast with their own fat. That can be done without any scars. Of course, it has to be the right patient. So sometimes I do a breast lift as well, together with a filling. But all of that will be discussed during a consultation.
Interesting perspectives. And now we're about to take a short break. Remember, our question of the day to you is, if you had a choice, would you surgically alter any part of your body. That is hashtag new normal. And of course, you can reach us on the numbers at the bottom of your screen. Karanja Njoguna says, God saw everything that he had made, and behold, it was very good, and he validated it completely. So I guess Karanja wouldn't. Nick Katete says, yes, the rough endoplasmic reticulum. They make my life so rough. I need a smooth life. Doctor, you'll tell us what that is. Shiko says, yes, my bicep tendon, they are too full. Interesting. How do people know this stuff? Carol Chalmers says, nope, plastic surgery is like a drug. It's addictive. You do it once, you like the results, then boom, everything you have is bad. You'll keep going for surgery. Musho unaka scarecrow. All right, Wanjiko Angogi says, I would enhance my bum and hips, then look for a wealthy businessman. Nairobi Hustle is getting on my house. Oh my word. Okay. Moash Muriuki says, I'm fearfully and wonderfully made. I guess Muriuki would not go down that road. Jeruto Sheila says, yes, I need more layers of cartilage for my heart. Interesting. Then we have Pauline Bogwa who says, no, I could not, but can just improve on my own. So I guess you would go the exercise or diet way. Kondu Nash says, why should I? I'm perfectly made. Good self-esteem. Yay to you. Akinyi Peggy says, yes, I need a tummy tuck. We have another Hero's Blessings who says, yes, my roto tongue. That means the girth area, the pot belly. Ray Ocher says, cosmetic surgery isn't the way to go unless one is suffering from a serious condition which can only be cured by cosmetic surgery. Personal opinion. We hear you, Ray. Mark Dickens says, if surgically changing that part of my body is going to have a positive influence to my future lifestyle, yes, I will. Very open-minded. We have I'm so blessed says, absolutely, a little nipping and tucking is essential in life. Interesting that we have more and more open-minded people in Africa. Brian Scott says, why though? Na binguni tutapewa mwili mpya. In heaven we'll be given a new body to work with, so why tamper with it? Now when we come back, we'll hear more from the doctors, even as we understand what are some of the other qualifications the patient has to have to undergo a procedure, because I'm sure it's beyond the psychological. There are other things that you look at, but also from the recipients, what these procedures have meant to them, and if perhaps they would recommend the same to other people. We'll be right back.
Breaking news from Molfix. Let's see what they're developing right now.
Molfix pants with anatomic fit technology. New Molfix pants, an invention from babies for babies.
You should also try Molfix.
New Year comes with New Year deals. Renew your corporate subscription and get a bonus. Subscribe to Nation e-paper for 3 months and get 1 week absolutely free. 6 months and get 2 weeks absolutely free. 1 year and get 3 weeks absolutely free. To sign up, visit epaper.nationmedia.com or email subscription@ke.nationmedia.com. Offer valid till 28th February 2021.
Try Panadol Advance for relief from headaches, body aches, and fever. With Panadol's Optizorb formula, the tablet gently breaks down in the stomach, quickly absorbs, and starts providing pain relief in 15 minutes. For fast and effective pain relief that you can trust, try Panadol Advance.
Thank you for staying with Your World. My name is Gladys Gashanja, and today we're talking about cosmetic surgery, plastic surgery, reconstructive surgery. And it's interesting that a lot of you actually do know what we're talking about. Others are very curious. Others have actually said if it wasn't about the money, you would do it today. So to help us with this conversation, we have Dr. Tillman Stash, who is a plastic, reconstructive and aesthetic surgeon at the Vitality Fountain Clinic, Dr. Christina Sule, consultant obstetrician, general and cosmetic gynecologist at Alora Medical Practice, and of course our recipients this morning, Pauline Buoga Diambo, who is a Gigantomastia patient, and of course Lucy, not her real name, who has gotten a tummy tuck, and she's joining us on phone because she'd like to stay incognito, and we'll talk about why she wants to stay incognito to start with. But hey, we have a caller online. What's your name?
Hello, my name is Robert Oino.
Okay, Robert, what's your question or comment?
Okay, I just wanted to ask the doctor, I had an accident earlier last year,
Yes.
and when the stitching was done, my right side of left my head,
Your what?
the head, the right side of it, it was almost, we were on a motorbike, and I didn't have any helmet.
You were on a motorbike but did not have a helmet on.
Yes.
Uh-huh.
So eventually, the time I fall down, I found myself unconscious. I just went to the hospital, and I was told that there was a small stone that got into my right heart, my side.
Okay.
So the stitching, when it was done, I thought it was properly done. But right now, there's developed some external externally.
A bulge.
Pardon?
What has it developed? I can't hear you properly.
The growth.
A growth, okay.
It's external growth.
Uh-huh.
So at times when it's cold, during cold time, I find it it is a itching problem. Yeah.
Okay, so you would like to understand what can be done about it?
Yeah, because people are telling me I have to go back to surgery. Some are telling me there's some drugs that can be used so that it's near there.
Yes.
Yeah, so that can get well.
All right. Robert from CIA, thank you for calling in. Dr. Stash, is this something that you can help with?
So I understood that he had an accident, he had injuries on his face, and that he had surgery to correct this.
Yes, and there was
And
a
then-
stone that was stuck on one side of his face.
Right.
Yeah.
And I think the bulge that he's talking about is probably a keloid, so a hypertrophic scar. So it's a condition where when the scar healing does not go smoothly, but it gets exaggerated, then you form something called a keloid. And these are the kind of things that I do as a plastic reconstructive surgeon, of course, especially if it's in the face. I'm sure he's affected by this quite severely. The reconstructive surgery might have put his face back together in a certain way, but now the keloids or the scarring is now impeding his appearance, and probably also a lot of the time with burns on the face, patients can't open their mouth anymore, can't open their eyes, or can't close their eyes. So that's when skin grafts come into place. Now, for Robert, I think if he came to my clinic, what I would do is I need to examine him first, see what's wrong with him. But if it is a keloid, then there are certain ways of treating that. There are excisional techniques, there's steroid injections. Those ones are the simpler ones to start off with. Again, to restore form and function.
Okay, so is this one of the things that you look into a patient before you actually undergo or take up any procedure?
I think keloid scarring is a genetic condition. So it runs in families, it runs in regions even.
Yeah.
So it's very important to ask beforehand, do you have good or bad scarring? Most of my patients would say they have bad scarring, and then they show me their knees and then there's a scar, but then I say, okay, fine, that is okay. That's a normal scar from running around as a kid.
Yeah.
The scars that are not so good are the ones that are raised. So you have it on the earlobes, for example, after piercing, or after cesarean section. It might be the best cosmetic gynecologist doing the procedure, but you might still get a hypertrophic raised scar. And that is basically in the genetic makeup of the patient, but also the wound healing. So patients who don't heal very well, be it because there's a lot of tension, or there's an infection, for instance, or there's suture material that doesn't absorb properly, and those patients tend to get bad scarring. So that needs to be obviously avoided by the surgeon.
Okay.
But yes, I do ask beforehand.
All right, so if I had a keloid, would you help me out?
Yes.
So you can actually treat the keloid?
Yes, correctly.
So how would you treat it?
I have a lot of patients coming to me with large keloids on their ears. Obviously, it's an issue for them because now they have to wear wigs. They don't want to show their ears in public. And actually, it's a simple procedure. On the ears, the technique I use is a combination of excision, steroid injection, and pressure. And it's very important to tell the patient it's a journey, okay? So it's not a once-off operation, because the keloid can come back. And that's why I follow up all my patients for at least 6 months, even up to a year, to make sure that the wound is healing well. They wear the compression garments or the compression earrings. And if it does come back, that we treat it immediately. And then after a couple of months, usually I'm then confident to say, okay, fine.
Okay.
It's now going okay.
Interesting. So, Dr. Sule, what are these other prerequisites that you're looking to before you can admit a patient?
So for cosmetic gynecology, what I'm definitely looking for is the symptoms. So a patient needs to have the particular symptoms that are bothering her for me to be able to find the solution. And some of these symptoms include female sexual dysfunction, women who have, for example, vaginal dryness or vaginal laxity, or inability to achieve an orgasm or painful sexual intercourse. Or they have an appearance they're not happy with, an appearance that's interfering with function. For example, their labias are too long, or they don't have the youthful appearance, or there's a bit of sagging that has come with age. You know, maybe they encounter tears during sexual intercourse if they're perimenopausal, and so on. So first the patient needs to be able to have the symptoms, and then we need to be able to find the solution to that. Now, other than the symptoms, we usually have a very structured approach in my clinic. We administer something called a female sexual function index, which is a questionnaire with a series of questions describing what your sex life is right now. You know, like who initiates it? Are you able to lubricate? How long does it take? Can you achieve an orgasm? And then after the treatment, whichever treatment we embark on, we keep reassessing such that we have a structured approach of seeing whether our treatment is helping or not. And then, of course, we do have the patients who are reconstructive patients, patients who have undergone FGM, for example, and, you know, maybe part of their clitoris has been removed, or part of their labia has been removed or altered in some way. And then that's an obvious symptom. So the patient comes and says, look, I've had FGM before, or I had an accident, for example, and this changed, and so now we can reconstruct. So we are looking for symptoms, we're looking for appearance, and we're looking for a structured approach in assessing sexual function before and during and after we embark on any treatment.
Okay, and in a world where a lot of underlying conditions are realities, do you think through the health of a patient before you embark on any procedure?
Yes, we do, and actually that's something that needs to be assessed in quite detail. There are certain medications that people take that lower their libido. There are certain contraceptives that women can be on that can cause vaginal dryness. There are certain conditions that can cause lack of sensitivity during sexual intercourse. For example, diabetes really affects the nerve ending. So we do a thorough medical history and examination to be able to eliminate these. For example, women who have painful sexual intercourse may be just having a condition called endometriosis, where the lining of the uterus has now escaped the uterus and gone to the lining, to the area in between the vagina and rectum, and is causing a lot of pain during sexual intercourse. So we do eliminate all these before we say, look, this is actually sexual dysfunction, or this was caused by FGM, or this was caused by trauma, or maybe this is being caused by the fact that you're currently breastfeeding and you had a very traumatic delivery with an episiotomy, like maybe you, an episiotomy is a cut that women receive during labor to widen the vaginal canal. So when that happens, sometimes it can affect sexual function afterwards. So we do assess all these things that may have happened that are contributing to now the problem that is currently there.
Okay, I understand we have another caller online. Okay, I guess then we still have Lucy on the line, and I'd like to hear from Lucy. So you underwent this procedure. You say your life has never been the same again. You're very happy in your body. Would you recommend this procedure to somebody else, or have you recommended? Lucy?
Yes, sorry, there was a mix-up there.
Okay, so I'm asking, would you recommend a tummy tuck to somebody else, or have you already recommended?
In a heartbeat.
Okay, why?
Because obviously you have to seek the doctor's orders and guidance in depth. But as long as it's affecting your day-to-day life and it goes over and beyond maybe causing you pain, like in my isolation case, I had back pain. I will advise, because I don't see why not have something that.
Okay, interesting. So you actually mentioned that you had a son who had a dripping nose, and you actually recommended the same?
Yes, I have a son who had like what we call a water drop, you know? Yeah, water drop nose, and he went to see Doctor Star, and he was around 8 then, and he did like a mini nose job for him because he was going under a lot of stress at school.
Yes.
Being bullied and all that, how kids can be very mean.
Yeah.
So I'm open to the cosmetic world if it improves my life in one way or another. Yeah.
All right, interesting. Dr. Sash, what's this nose thing?
I think the the condition she's referring to was a small hemangioma at the tip of the nose. So that's a blood vessel that has grown to almost like a cherry-sized bulb at the tip of his nose. Now you have to imagine, as a young kid, that is not a very nice thing to have, because kids are ruthless and they would point it out to you, and he was called all kinds of names. So having assessed that this is not a cancerous condition, I then surgically removed it with minimal scarring, and it went well, and the patient basically is happy ever after, I would say. Doing cosmetic surgery on children, I would say, is obviously controversial, but there are certain operations that are now recognized to really improve the patient's lives and the children's lives. This could be prominent ears, so tucking ears back, for instance, or conditions that we just described, or any congenital abnormalities that the child might suffer from. So those things kind of where I can then come in and shape it back into what society would call normal, that gives the child a chance for a normal life.
All right, now Pauline, you got a breast reduction.
I did.
You were a size?
I was a 36J.
I didn't even know there was a J.
I was a J.
So you went back to
a D.
A D.
Yes.
All right, and what's the difference in your quality of life now?
Oh my goodness. I think I felt the difference immediately I woke up. I was very light. And then I went to the mirror and there's a frame and I can see my waistline, as in I've never seen my waistline, and it looks so nice. And my life has been better. Everyone says that my personality has changed. I think I would just stay in the office and not really talk to people, but right now I do that a little. And the first time I went shopping for clothes, and things actually just, I can wear them from the top and not from down. It was an amazing feeling.
Oh wow.
And feeling light and feeling young, looking young. I used to dress old, like an older person. I used to like heels and whatnot, just so that I would look the part. But right now, I want to dress like a small girl. Yeah, because that's what I feel right now. Yeah.
You're literally reliving your childhood again.
Yes, I am.
Wow.
And it's exciting.
Okay, would you recommend this?
I would. When my story came out on Instagram, I got so many DMs from so many other ladies, and we have these discussions on WhatsApp, and I just encourage them to do it. And if you can let me speak to your parents, because the parents are usually like, oh, nah, we're not going to do it. And if you want me to speak to them, you can even show them my photos, and I did not die, so you can also do it. So yeah, I talk to so many girls and I'm just like, go. If you have to do it, just go.
Okay, talking about the apprehensive lot, I mean, most people think fast it's life-threatening, and for some it's just that they don't have the money to do it. I'm just curious, if this is something that runs in your family, why didn't your mother run for the same opportunity?
Oh, we didn't have the money. It's actually funny how I got the cash. I got a friend of mine, and we got friends. We were like, of course I went through the foundation that helps with 70% of the cost, so you have to get the 30. So friends just came in on WhatsApp, and because all of them just wanted me to look good and feel good, so they came in on WhatsApp and we got money, and then I went in for the surgery. Yes.
Interesting. Pauline, I'm curious to know, how did you cater for your expenses? Was it out of pocket? Rather, Lucy, is it out of pocket? Or did you have insurance cater for it?
So for me, it was like I personally catered for my expenses. Yeah, 100%.
Okay.
Yeah, because as much as it was causing me a lot of back pain, it was hard to justify to be covered with my insurance.
Interesting. And Dr. Sule, I'm sure you see a lot of need, like medical need, but some of it just doesn't sound like it's a need. It's something you can live with, so it's categorized as cosmetic. How now do you explain to the insurance guys which is which?
Yeah, the truth of the matter is that it's very difficult to explain, and this is something that puzzles me about insurance, because when a patient comes in to my clinic, and she tells me that she feels like her marriage is breaking, she tells me that she can't sleep at night, she tells me that every single sexual encounter is pain, or every single sexual encounter arouses nothing in her, she is definitely psychologically impacted about this. This is something that is going to affect her marriage, her relationship, her children, her spouse. To me, this is definitely something that needs to be covered by insurance. And unfortunately, these procedures are not covered by insurance. They are considered a luxury, they are considered unnecessary, they are considered as probably not impacting your life to the extent that the insurance company would want it to. But I feel that if they just sat down with the doctors and assessed, even on a case-to-case basis, how badly is this patient affected psychologically, physically, sexually, they will be able to understand that this is something that actually needs to be covered. Even if it's not all the procedures, some of them do need to be covered, I think.
Dr. Stash, from your experience both in this country and abroad, how does it work in the Western world? Do they cover this, or it depends on the case?
I think there are certain criteria that insurances use in order to say, okay, this is covered by insurance and this is not covered. So if you have, for instance, talked about the rectus diastasis, when the six-pack muscles comes apart, a certain degree then is covered by the insurance, especially if there's herniation. So if the bowels are coming through either the belly button or through the midline. So in Kenya, some of the bigger insurances also cover that. Because it is a medical condition. Other things like Gigantomastia definitely impact the medical condition of a patient, so that those surgeries are also covered by some insurances. Overseas, I guess other medical issues, I think the prominent is we were talking about bariatric surgery, so the weight loss surgery. I think that is a huge impact on the person's life. So somebody who's obese will develop diabetes, high blood pressure, etc. Undergoing bypass surgery, I think, can put them back on the right track. And then we have, as plastic surgeons, we basically come in to remove all the excess skin. So you can imagine somebody who was weighing 120 kilos suddenly goes down to 70. There's a lot of skin that needs to be removed in order for them to look good in their own skin again. So that's where the plastic surgeons come in, and some of those procedures are covered by insurance as well.
Okay. All right, so I am curious to know, if you had the money, would you go for it? Really, talk to us. That hashtag is new normal, because clearly from what I'm seeing, a lot of you are saying, if I had the choice, if I had the money, I would. But I would want to understand what is standing between you and these procedures. Remember that hashtag is new normal. Now, let's talk about the men. Do you see the men coming to you?
Yes, I do.
And what are their needs?
I think it's funny enough. Those are conditions where they're quite similar with large breasts in women. Something called Gynecomastia, or colloquially known as man boobs, is a condition that you might not recognize, even if you know that person, because that person will always wear a baggy t-shirt or always wear a tight vest and always hiding his man boobs. So gynecomastia is a very common condition. It does run in families. I have one father who brought his son, and then once I did the surgery for him, he decided to do it himself and then brought the other son as well.
Yeah.
And so it's a medical condition where during puberty, men develop breast tissue because of the estrogens, and normally those breasts will then decrease again in size. However, in some patients they just maintain and they get bigger and bigger. So you will try everything. You will go to the gym, you will try to lose weight, you will try to hide it. But then surgery comes in where we use liposuction and also excision of that breast tissue, which medically just cannot go away. So there are no pills, there are no creams for that. So that's one of the commonest operations I do for men.
We don't have men coming to say, I would want my backside to look better.
Interesting, yes, but in those cases, I have a few men who've had their back sizes reduced. So there are men who have a kind of more feminine pattern of their body. So the flanks, the love handles, and then a round full buttock.
Yeah.
And they find it extremely disturbing for them. So I've done liposuction on that. I also do liposuction on the torso, on the big bellies, but that is not as common.
Interesting. We have a caller on the line. What's your name and where are you calling from?
Hi, Gladys.
Hi, Carol.
Yeah, my name is Carol. So my question is to, I think, the Vitality Clinic doctor in regards to the Kenyan butt lift. So I have been hearing or reading online, on Instagram, on Facebook, that there's so many Kenyan women who are doing this butt lift. But yet apparently they say when you do that procedure, you cannot sit on your buttock for like 2 months. And they also say it's a very risky procedure. So I think if you can you talk more about that, the risk of that butt lift procedure?
Okay, Dr. Stash.
Yeah, it's a very good question because indeed it's a procedure that is not without risks. If you look at the literature, it actually has the highest mortality of all cosmetic surgeries. Mortality means the patient dies from it. Now, that doesn't mean it's a dangerous procedure. It probably depends on who's doing the operation. So those women who've had the butt lift, usually in South America, there are a few cases in the Caribbeans, in Europe and America, where the fat transfer that is done just goes too deep. So surgeons who don't know the plane well enough, they put the fat into the muscle, and the muscle has a lot of blood vessels, and the blood vessels can then rupture, and you can get the fat going into your bloodstream. It can cause fat embolism. That is very dangerous and should be avoided at all costs. Yeah? So that's why I call the butt lift a safe butt lift. So I go to conference, or I used to go before Corona, to all kinds of conferences talking about this topic, because I mean, I've been in this field for doing the fat grafting for the last 10 years, and I think there are certain techniques that need to be, or certain safety measures that need to be adhered to in order to make it a safe procedure. And I think that's also where the expectations come in. You cannot have somebody with a very, very slim buttock and then you want to have the perfect Instagram massive size hip. That is just not possible in one go, and it's not safe. So undergoing this kind of surgery, I think, is possible. It's safe in the right hands. But going to the other part of the question, not sitting. So the secret there basically is the fat cells that we use are live tissue, okay? So transferring that into your tissue of your buttock basically means that you cannot put pressure on it. So if you put pressure on the fat cells, then they don't have enough blood supply and they just kind of disintegrate. So that's why I encourage my patients to maybe sit at the edge of the chair or lie on their side or on their tummy for the first 3 weeks in order to allow the tissue to heal really well. After that, I guess it's up to the patient to find a way around it. Most of the time it's safe to sit, but maybe not for 2 hours. And then as the tissue takes, so as it grows its own blood supply, it then becomes permanent.
Okay. All right. We take another short break on Your World, not unless we have some feedback. Yes, we do. Remember, that question is, would you alter any part of your body surgically? We have Charlie who says, I'll change my nose because I just don't like it. Charlie, thank you for sharing. We have a great ape who says it's not about choice, it's about money. Always has been. Another one who's saying it's only the money that's stopping him. Oteno says, yes, my legs, what about them? Are they small or big? Tell us more. Doreen Candy says, yes, I would change my face to look like that of an actress. Prachi Desai? Really, Doreen? Okay, interesting. Danny Gaduru says, can a burn scar be eliminated? Dr. Starch?
Yeah, so burn scars can be improved. Okay, so it depends on where they are and what part of your body and what kind of burn scar it is. Sometimes it's very mild, it's just hyperpigmentation, so the color is different. Sometimes it's just slightly thicker skin, and sometimes it's keloidal skin. So there are different operations that we can do, from excision to laser to skin grafting, etc. But fat grafting is also one of the techniques I use a lot for scar treatment, because the fat that you take from your own body contains stem cells that have an amazing potential to heal. So I use it on chronic wounds, for instance, diabetic ulcers on the feet, to heal wounds that haven't healed for months and years. So the same allows me to make scar burns or burn scars to become more supple. For instance, I have a patient who was burned in her face during the post-election violence, and through serial injections of fat and microneedling and reconstructive surgery, she's now able to open her eyes, wrinkle her forehead, and have facial expressions.
Interesting. When we come back, let's talk about the impact of social media on this industry, because of course we are seeing a lot more of these procedures today. Why? We'll be right back.
Family is working together today. It is creating opportunities for a lifetime of happiness. The future is bright because you can always bank on family. Family Bank, with you for life.
To achieve great things in life, you must do little things every day, like the 1, 2, 3 with Colgate. 1, wake up, wake up. 2, brush up, brush up. 3, smile through your day with a fresh breath and strong tea. Smile through your day with a fresh breath and strong tea. Do the 1, 2, 3 with Colgate and give yourself a future to smell about.
Hii nayo utangoja sana nichukue. Sichukui, niko juu ya pikipiki. Na sheria ya barabara inasema heri kupata missed call kuliko kupata ajali.
To get Piki Piki by Adis Jojo, dial star 811 star 936 hash. Skiza, Nan Nation.
Timeless love.
Ezekiel! Ezekiel! You have to help me!
What happened?
I'm being kidnapped!
What are you doing?
Let me out of here! Let me out of here!
The car is following us! Blanca, stop it!
Let me out!
Carlos, if something bad happens to you because of me, I swear I'll die as well because I wouldn't be able to bear it.
And I'll die without your love. So I'd rather die, but at your side, Matilde.
Timeless love.
Beat sensitivity pain fast with Sensodyne Rapid Action for clinically proven relief in 60 seconds.
Try Panadol Advance for relief from headaches, body aches, and fever. With Panadol's Optizorb formula, the tablet gently breaks down in the stomach, quickly absorbs, and starts providing pain relief in 15 minutes. For fast and effective pain relief that you can trust, try Panadol Advance.
Thank you for staying with Your World. My name is Gladys Gashanja. Still have our doctors in studio, Pauline and Lucy, not her real name, online, even as we talk about plastic surgery, cosmetic surgery, and I mean, it's interesting, rather cosmetic gynecology. It's interesting that a lot is coming out of this with a lot of people with interest on how they can actually do this, and the only thing standing between them and the procedures is the money aspect. But now that we're living in the era of social media and everyone wants to look like a certain superstar, we just had one viewer say they would like to have the face of a popular actress. Dr. Stash, if I came and said, I'm healthy, all I want you to do is make me look like a superstar, would you take me up as a patient?
I think the first thing I would tell you is you look like a superstar. And then I would question her, what are your motives? And I think very soon I would find out, you know, is it something that I can do or can't do? And I'm certainly not gonna model you according to a picture that you'll bring me. We all know Botched on TV, and I actually respect those two doctors. They're extremely well qualified. I love the work they do. But the patients who come in to see them, they probably have been worked on by not so qualified doctors who would say, okay, fine, I can do that for you because you'll pay me money, and then I'll give you a triple F-size breast that you can't even walk with. And I think those things are really not safe. What does social media do to patients? Yes, of course, it puts a little bit of pressure on them to look good. It's something I see in my practice. Patients coming in with Instagram pictures saying, okay, can you shape me like that? I think it's important to then say, okay, your genetic makeup is different. Okay, your body is different. You know, you don't want to look like this. Yes, maybe I can change this or that on your body, but please don't show me this kind of picture because you might not be able to look like that in even after several surgeries. And questioning why they want to look like it, I think is also very important.
Okay, and somebody could be wondering, Pauline, why are you greatly perhaps influenced by seeing the possibility of this being done in other countries to know it's something you can take up?
I wasn't. No, it wasn't social media, it was entirely me. It was my decision, it was not pressure from any source, it was entirely me. Yeah.
Let's say we never had Western television, you didn't have social media, you didn't even know there was a possibility of such a surgery to be successful. Do you think you would have gone for it, even with all the apprehension you had?
I think I would just live with myself. Yeah, I learned about Gigantomastia on the TV and their Facebook and all those social media sites, and then I was like, oh, it's actually something that I can do. Then I decided to do it, and of course my mom also saw it from the media and encouraged me to do it.
So there is an influence.
There is.
Yeah, information is power.
There is an influence, yeah.
Okay, so the question is, and I think one of our viewers had mentioned, the moment you do one thing, you just want to keep doing it over and over again because of the euphoria of the new you.
Yes.
Do you feel tempted to?
Yes. I have quite a belly. I don't know if it comes with Gigantomastia, but every other person I've talked to has a belly after the reduction. And then we're usually just like that, could we do it? Could we have like a tummy tuck? And then everything would just be perfect and all those things.
Yeah.
I wouldn't, but like it's something I have thought about.
You wouldn't mind, Pauline, would you? All right, doctor, is there something you see common that most often than not when you do reduce the boobs, you'd have to go for the tummy too?
Well, it's almost like when you fix your eyes, then you suddenly see your wrinkles. So if you came to me, I would say just work it out, just exercise, go on a good diet, healthy lifestyle. You can do it yourself. It's you're still young. You don't have kids, I assume.
Yeah.
So I would certainly not advise you to have a tummy tuck. So work on it first. You'll feel much better yourself.
Okay.
Patients coming in saying, "Oh, please, help me lose weight." I'm like, "Yeah, I'll help you, but after you've lost weight, I'll do the surgery."
Okay.
So yeah.
Interesting. So perhaps the tummy is a coping mechanism to the Gigantomastia, right?
Yeah.
Okay. All right. Try out the working out and let us know how that goes for you. I'm curious about Lucy. Lucy, you said you tried the exercises, you tried the diets. Did you really try, or you got to a point where you're like, this is too much damage, I might as well not even try?
Yeah. Honestly, before I went under the knife, I really tried a lot, yeah? And because even after my procedure, I just continued with my lifestyle, and I still look good. I still retain what we achieved with dogs 4 years later. So you can there's a habit there, there's a habit there, and it's sustained. That's why the results are sustained so far.
Interesting. Dr. Sule, in a world where we're saying, drink this, it will do this for you, eat this, it will do this for you, cultures that actually have women who are dedicated to ensure the reproductive health of a woman is top-notch, and then here you come with cosmetic solutions. What's the uptake?
Honestly, to know the true uptake, especially in Kenya, you'd need to do a study. You wouldn't be able to know just off the top of your head that this is the uptake. However, something that I can say is that initially when I began cosmetic gynecology, I thought it would just be an added service to my patients who were going through menopause or who had just delivered and now, just needed that extra boost of self-confidence after delivery or during menopause or during sexual dysfunction. But it quickly became more than 70% of my practice. So there is quite a bit of uptake. I agree with Dr. Tillman. I don't usually, succumb to the whole, someone comes with a picture of a vagina and says, I want my vagina to look like this. I don't do that because it could look very different. But I can tell you that there are certain expectations that women have. And I try to fulfill those expectations according to what their body is going to look like. So I'll tell them, look, you're not going to have this, but this is what I can do for you. So I don't have exact figures, but I can tell you that more than 70% of my practice right now is cosmetic gynecology.
Tell me, what is the biggest influence? Because, okay, you've got issues, but then again, there is the aesthetic influence. I want to have something like that. I want to have this kind of performance. Where is this coming from? Is it social media?
Frankly, in Kenya, as a cosmetic gynecologist, women look not so much for aesthetics, but more for function. Women want to be able to have better sex, to be honest. A few, of course, do want to look better, but mostly it is sexual function that brings them to a cosmetic gynecologist. They're like, look, this is the problem. Can it get sorted out? Now, I don't want to discount the influence of social media. It does have quite a big impact, but for me, it basically allows women to be more vocal about their sexual experiences, to be more vocal about the kind of, sex life that they have, the kind of problems that they're experiencing, and for women to be able to find solutions, for women to know that actually what you have, there's a solution to that, and it is available in Kenya. So for me, that's where social media comes in.
So even as we bring this conversation to a close, Dr. Stash, is plastic surgery, reconstructive, and whatever else that you offer for everyone?
Absolutely, it's for everyone. It's a matter of your own decision, of course. I spent last weekend. I spent in Diani, sometime in Diani, with some ladies who are very happy with their bodies.
Okay.
And we talked about cosmetic surgery, plastic surgery, what can be done, and what is it like, to educate the public. And so somebody who might be overweight in somebody else's eyes might feel wonderful, so they don't have to come for surgery. Somebody who has some areas that they want to change, yes, they're welcome to come. So is it for everyone? I think that is everybody else's, their own decision individually.
Okay, but definitely for you to take up a patient, you have to undergo a certain procedure for you to say this is a candidate and this is not.
Yeah, I think we talked about the motives
Yes.
that the patient has. Certainly the patient has to be healthy. So you don't want to take any risks with cosmetic surgery. You want to make sure your blood tests are normal, your heart is fine, your lungs, and those kind of things. You know, you might have a family of thrombosis or blood clots in your legs. Things like that would then tell me as a doctor, okay, well, is it really something that is worth doing for you, or do the risks outweigh the benefits? So there's a very definite protocol that I go through with every single patient.
Okay, now over to Lucy. You clearly said you don't want to be seen and we had to change your name around. Why?
The reason why I decided to go anonymous is I want to help other women and tell them there is, there is a possibility out there to alter your life for the better. If you just go down that lane. But I'm still heavy on privacy, you see, so it's a very it's a very delicate position to be in. But if they want like a more one-on-one, I'm free to sit down with them and settle their fears, woman to woman. But I'm still very heavy on privacy.
Okay. All right. So is backlash, stigma about this, procedure you took a concern for you? Is that what you're saying?
Yeah, there's a gray area about stigma locally, so some waters I don't want to tread on.
Okay, I see. And even as you came on to this conversation, you said the benefits you've had to live with and all that. Somebody is asking, why wouldn't you just exercise? We see amazing pictures from these different physical fitness guys who say before and after, and it looks so possible. So why wouldn't you just go the natural way?
Yeah, and maybe Doc will explain further, like medically. But what had happened is like I had torn my muscles. My abdominal muscles. There's no amount of exercise, eating right, fasting, maybe.
Okay.
Obviously, he has all the medical terminologies to back me up, but that's basically.
Okay, and I think, Dr. you had actually mentioned the fact that there are some situations where the muscles have too far gone. They need help to go back to their original state. And Dr. there are those who are saying, we are told, do Kegels, do all these other things so that you can be top-notch in this area. Are we saying this doesn't work and you have to undergo a procedure?
Okay, so Kegels is a very interesting question because I get asked that question so many times. So the first thing is that Kegels improve the pelvic floor musculature. So they make the pelvic floor stronger. They'll improve urinary continence, but they will not cause vaginal tightness. So you can have a strong pelvic floor in terms of the muscles. You're able to grip. You're able to, hold your urine very well, but that does not mean that you have vaginal tightness. The two are very different. Now, you can do Kegels. However, for you to regain your Kegel strength to what it was prior to a vaginal delivery, you have to do about 3,000 Kegels a day.
Ooh.
Now, I don't know who has time for 3,000 Kegels a day, but it's a lot of work. It can work. Let me not say it cannot, but it requires a lot of discipline, a lot of work, several Kegels. Now, we do have some solutions in cosmetic gynecology. We have some machines that can do the Kegels for you. They're not yet available in Kenya. So basically we have a machine that does 11,000 Kegel contractions for you in the span of 28 minutes. And I think that's a better way to go than sitting at home or probably having to stop everything you're doing to sit down and do Kegels. So that's basically where we are with Kegels. It's not that it cannot work. It can work. And even for weight loss, if you did, for example, instead of 2 hours, if you did 4 to 6 hours in the gym and you ate very little, you could eventually lose weight. But you need to also think, what is it taking me to do this? Am I spending my time usefully?
Yes. And a question here from Pauline. So you underwent surgery. Does it mean now you're healed of the Gigantomastia, or this is something you have to live with and it could recur?
Well, the doctor says it cannot recur. So I am free from Gigantomastia.
Interesting.
Yeah.
Dr. Stash?
Yeah, I would agree with it. Her breast tissue is more or less the same as any other normal breast tissue. So I think the term just describes the size of the breast.
Okay.
And yes, after breast reduction, she can have a completely normal life. The cases where it recurs are usually associated with tumors or cancers, or no, it doesn't have to be a cancer, but it can be a benign tumor. But those are extremely rare. So she still has to do her examinations and go for checkups. But in terms of going back to where she was, that'll never happen.
Dr. Stash, is there maintenance that comes with these procedures? Like if now I do my lipo and all that, do I go back to eating everything and anything and looking good, or I have to take up a clean, healthy lifestyle to maintain it?
Yes, please. I think there's so many benefits of having a healthy lifestyle. Generally, you just feel better and it's just healthier. And nowadays we live in an age where people just don't want to grow old, right? And just have a healthy lifestyle. If you invest the money to have cosmetic surgery, then I would definitely encourage to maintain the weight, maintain the diet, exercise, and you'll have a good life afterwards. If you don't adhere to it, to be honest, the shape, the new shape will probably stay. Okay, so plastic surgery is permanent. But if you gain weight and you lose weight again, there will be changes. But generally, after a tummy tuck, I hardly see anybody coming back for a second tummy tuck, even though they might have another baby or two.
Oh, really?
Yeah.
So it's permanent?
Pretty permanent, yes.
Interesting. So if I gain weight, I'll gain it in other areas I never had a procedure.
Well, I think the sculpting part is what is permanent. So if you have liposuction, for instance, if you have a tummy tuck, if you change your breasts, then that shape will remain even if you gain another 10 kilos. You might get bigger arms because proportionally there will be more fat on the arms now compared to the tummy, because you just have less fat cells left over.
I see.
But it's still proportional.
Okay, interesting. Before we say goodbye, I hear we have some feedback coming from you that hashtag new normal, even as we understood, if you would actually alter any part of your body surgically, if you can have that on screen. Justine Orucho says, admiring the content that the host and guests have. Very educative, good discussion. You're well schooled. Thank you, Justine, for watching. Rutere Kagendo says, truth be told, this is only for the haves. Only those who go to public maternity hospitals can understand me. We pop out, tie our lessons, and boom, life goes on till the next episode. And aren't we beautiful? I just love women. Dr. Sule, even as we close, what would you like to say? Because true, there are some people who snap back. There are others who don't get that lucky.
Yes, there are some women who are genetically predisposed to their bodies returning back to normal.
Factory settings.
Yes, very quickly. And that is the truth of the matter. But a majority are not. I'm yet to meet women who remain exactly the same as they were before having a pregnancy and delivery. And I do agree with Kagendo about in public hospitals, it's the way of life. You deliver your baby and you move on with life. Doesn't mean that you'll not face the same problems, because problems like vaginal laxity and other female sexual dysfunction after delivery is faced by all people, those in public hospitals, those in private. If, for example, you have a good gynecologist in a public hospital and you've had to have an episiotomy and your gynecologist repairs it nicely and you request them to maybe make it a little bit tighter, that's a plus, because you can get that even in a public hospital. You don't need to have cosmetic surgery for that. So there are certain things that you can do. I understand exactly what she's saying about the lasso.
Yeah.
Basically, it's
The
to be able to
tying.
bring the abdomen back together,
Yeah.
and it has culturally worked for some women. Doesn't work for every woman, but yes, it is definitely a possibility. It's not out of the picture just because we do cosmetic gynecology.
All right. So, Dr. Stash, I'm sure you know there are people who actually snap back and others just struggle through this. So, your words of advice if somebody's thinking about taking this path down cosmetic surgery?
Okay, I think you need to find a experienced plastic surgeon who's board certified, who's had the education and the experience in hospitals that then allows him to be, or her to be, a safe surgeon. I think also rapport is very important. If you don't like your doctor, you don't necessarily have to have the surgery with him or her. So I think choosing the right fit is important.
Okay. All right. And to Lucy, not your real name, your words of advice for those that are thinking, hey, I want that katami after my 5 children.
Go for it. Like you thought, to just second guess. You follow your darker line, and obviously, with doctor's orders, go for it.
Okay, and for Pauline, Gigantomastia, some people are hearing this for the first time, but they relate to the condition. Your parting shot.
Yeah, get a good doctor. Get a good doctor. Get a good doctor. And then if you're not so sure, talk to someone who's had the surgery done. They can take you through the recovery process and all those things. Yeah.
Okay. And
but before then, love yourself. You can just, before you can do something about it, you live with it, but love yourself. Yeah.
And for those that are so brutal?
Well, I don't know.
Be empathetic. Be empathetic. There's some people who can't do anything about it.
Yeah, just, I don't know what to say to them. I honestly don't know. Yeah, it's too bad.
It's unfortunate it happens, but that is the reality. But I am so glad we had this conversation. A lot of wisdom coming out of it. And thank you to Dr. Tillman Stash, plastic reconstructive and aesthetic surgeon, Vitality Fountain Clinic, Dr. Christina Sule, consultant obstetrician, general and cosmetic gynecologist at Alora Medical Practice. We celebrate you, Pauline, for coming through and being so brave to actually tell your story. And of course, Lucy, even if you're incognito, we appreciate you for being part of this conversation, and to you for also chiming in on the same. And of course, if you have any questions, because I can see a lot of those that you'd like to pursue the doctors with, well, you can reach them in their respective clinics and they can be able to help you out with any of your queries. My name is Gladys Gashanja. Tomorrow, my colleague Victor Kiprop will be with you talking about thriving businesses. Yes, we are in a pandemic, but there are some people who have found a silver lining. So how are they doing this, and what is making them stand out from the crowd? We'll find out tomorrow. See you then.